A, we want to see if they're level. So we've determined that they're level. Now what we're going to do is have her do a hip flexion maneuver, which technically will take the side that is being flexed will come down. Okay? So Rhonda, what I'd like you to do is stand on your left leg, lift your right knee towards your body. Oh my goodness. Relax down. This part is really good. There's a few things that I noticed there. Okay, just do it again for me. You don't need to lift it too high, just up like that. Okay, you can see she's doing really well at the SI joint, all right? This one is dropping down the way it should. Okay, back down. But what happens as soon as she tries to stand on this leg, her whole body's shifting over. She's got weakness in her glute muscles here. Okay, so that's the other thing that you can notice with this test is there weakness on the glutes, because the side that you're standing on should remain level. It shouldn't shift like that. Okay, so now this time stand on your right leg, lift your left, and she's a little better on that side now, whether I've given her the cue to watch for that, and then down.
Well, I just didn't think you could say that had a solid leg.
Yeah. Oh, you gotta love it, eh? Okay, so you can see that she's got movement. She's got good movement of the SI joints. Okay, that's fine. So that actually is moving on her. The lumbar spine isn't moving, but her SI joints
I mean,
are
I
moving.
think it could be too, because I make a point when that's probably a normal stretch that I
It is,
try to do,
yeah,
so
yeah.
that might be why.
Okay, so anyway, you are moving fine through there, but her glutes, especially on this left side, are not as strong as they should. I'm going to quickly go through just, this is a test that we actually cover in the hip joint stuff, but I'll just run through it quickly. And it's called the Trendelenburg test, and it's basically an observation test. So what it is just asking the patient to stand on one leg, and so you can do it without having your hands on them. So just stand on your right leg for me. Okay, so you can see that everything has remained level there. Okay, and then stand on the left leg. Oh, she's better. She's engaged now. She's thinking about it. When she wasn't thinking before, things were dropping a little bit. Okay, so she's actually got the butt working. Okay, but that's called the Trendelenburg. We'll cover it more in the hips. So. Okay, so that is your Gillette's test, or this is really a kinetic test, kinetic being movement test. Okay. Now we're going to see how tight she is. So come on down to the end of the bed here, and I want you just sitting on the very edge. Okay, scoot right forward so your feet are basically on the floor. So with this test, you want to start them sitting on the very edge of the bed, okay? If they're sitting back, you're not going to get a true view as to what's happening here. Now, she does have jeans on, so we'll give her a little bit of a break, but they're stretching. Perfect, okay. Bring one knee up towards your chest and hang on to it. Hug it in nice and tight. Is that okay on your back? Okay. So then I want you to lie down onto your back. It's always nice just to put a hand in behind them. It just helps, especially if you have back pain. Relax this leg down. Okay. So what you're looking for here, you're looking at the leg that isn't up to the chest, okay? You want to see three things. We're looking for three different muscle groups here. We want to look at the flexibility of the quadricep muscle. So if the quadricep muscle is tight, we'll see what Rhonda has here, where that leg is not bent close to a 90-degree position. Now she can get it into a 90-degree position fairly well. Yeah. So she's a little bit tight, she's not really tight. I've seen patients that are way out here, and as soon as you try and bend them, they're like, ah! Stop, because it's stretching so much. So she's not too bad. I can actually get her down into that 90-degree position, but she can feel it stretch. Then you're going to look from above, and looking from above, I should see that her leg comes straight forward. What I'm seeing is that she's winging out to the side a little bit, right? So she's actually not right in alignment with her body. Her leg wants to sit slightly out. That means that her iliotibial band is tight, okay? And all of these things are important when we're looking at the spine. I'll explain why in a minute. So quadriceps, slightly tight, IT band, slightly tight. Again, she's not winged way out like this, like some people are, okay? The other thing that we're looking for is to see if the leg is at least parallel to the bed. If she's parallel to the bed, then her hip flexors are okay. If she's tight, what you'll see is the leg will be lifted up like this. All right, so that's an indication that the hip flexors would be tight. So let's just compare it to the other side. So bring this up. And again, it's important that that knee be hugged into the chest because that's going to stabilize the pelvis. Bring this leg down. Okay, whoa. Okay, so there's a little bit of a difference there between sides, all right? So now we can see again she's kind of tight in her quadricep muscle. little bit tighter on this side. Yeah. Okay, that's that whole left side thing. And look at her IT band. She's really winged out on that side, right? And I think that's because her glute is weak, because that's a secondary thing. Yeah, okay. The sciatic won't necessarily create this. It can affect it, certainly, because it's going to affect the mechanics around that hip. Usually, when we see people with tight IT bands, it's often because they're weak in the gluteus medius muscle in particular. So their glutes are weak. And we saw that when she was trying to stand on that one leg, that her glutes are weak on this side. And so when the glute is weak, it's not keeping you upright, it's letting you hang out like this. Now what will happen to try and keep you somewhat upright is your tensor fasciae lata, the muscle right along the side here, is going to tighten up. That's one of the main attachments of the IT band. And so you'll often see this. So when we go through the lower leg, we deal with the IT band a little bit more, especially with the knee area. And often we have to go back up to the hip to see if the glute is weak. So she's definitely tight there. Now she's still pretty good. She's still pretty level in her hip flexors, right? So she's not too bad there. Okay? Right. On to that. You okay? All right. Our next one is compression. So scoot all the way up the bed here. Get you lying on your back. And slide it behind here. Okay. When I'm getting people into position for this, if they have back pain, I usually say bring one knee up to your chest at a time. It's hard for people with back pain to try and bring both knees up at the same time, okay? It's just uncomfortable. So one at a time. Help them if you need to, all right? And then what you're doing, we used to do this, where you're putting your arm on your butt to give them compression, so pushing in like this, but you know, it's a little bit too personal for a lot of people, so we tend to go through the feet. So what this does is it creates kind of a passive flexion motion in the spine, which is going to compress the discs anyway, because remember, flexion compresses the discs. And I'm also pushing up a little bit, so we're getting some compression that way. Okay?
It definitely feels tight down there for me. I don't know.
Yeah.
It's like, but it's kind of a nice, it's like a stiff,
it's like a
stretch
kind of thing. Yeah, it's like, oh, I love that. Yeah. So, because you have no movement there, so it actually feels good to move, right? Oh, she moves when we do it, right? Okay. So that's the compression. And you just want to hold it for a couple minutes, or like not even a couple minutes, like a 10 seconds kind of thing. What we're looking for is any reproduction of pain, because remember, we're compressing through that disc area, so if there's a reproduction of pain, then we're going to think more possibly disc problem. Okay. Well, would you mind passing me? I just want to make sure I'm doing it in the manner as to which you guys want to learn it. Oh, then we do traction. Traction easily done in the lumbar spine, legs out straight. And what we're going to do is pull through the legs. Okay, so just grab them at their ankles. Comfortable grasp. Don't put them in ankle shackles.
All those kidney points.
Yeah, exactly. Ah! Okay, so all we're doing is just pulling. Now, what you'll find with this is if people have disc problems, they go, oh, can you just keep doing that? It feels so good, right? Because it's reducing the pressure on the disc. Again, if they have more muscular problems, it may bother them because the muscle doesn't want that traction if it's really tight or in spasm, so it may actually aggravate things. Right, then we're going to do the straight leg raise test. A straight leg raise test gives us two pieces of information. First off, we're doing it as a nerve mobility test. Okay, so we're seeing how mobile that sciatic nerve is. Is it being pressured at some point in time, or some point in the body? Because if it is being compressed somewhere, it's going to give you pain. So remember we did the slump test, which is like a nerve mobility test. We did that through the spine basically. That's another way to do this test. This one also gives us information as to the mobility of that sciatic nerve, so it's not taking up the whole slack of the nerve up higher. It's only taking up slack through the nerve from the lumbar spine, through the buttock, and down the back of the leg. Okay? So what we're doing here is we're going to lift the leg up. Now I like to have one hand on the pelvis, because if I do this, I'm not sure where the pelvis starts to move, okay? So what I'm doing, and try and do it passively, so just relax your leg if you can. And then I do it slowly, because if you've got somebody with sciatic pain and it comes on, they're like in mega pain, okay? So you are, because they kick you. Yeah, exactly. Okay. So generally what will happen, if somebody has a positive straight leg raise test and they have sciatica, once you get them up to around that 30-degree position, they may start to have pain. If they're getting pain at 30 degrees, it's a pretty acute type of thing. Stop the test. Don't try and push that sciatic nerve any further. You're going to really flare it. Okay? So make sure you stop the test as soon as they get pain. If they don't have pain and you can take them further, anything up to 70 degrees could be caused by the sciatic nerve. If after 70 degrees, that's where it becomes painful, it's probably more soft tissue stretch, so muscle stretch, that kind of thing, okay? And her hamstrings are really good, as we noticed when she was bending forward. She's got to have the movement somewhere, right? Now, we do it on both sides. Even if her sciatic pain is only on the left, just let me know if it's watching.
It's just sort of more of
It's okay.
I'm just at that numb phase where it's just
okay.
I'm
So
not able
that
to
doesn't
undo
aggravate it
no.
necessarily? Okay.
Yeah.
So for example, Rhonda has sciatic stuff on the left, and if she was having acute compression of that nerve root, as I lifted the leg up, she would possibly get reproduction symptoms, which would be leg pain. And remember, we're testing the sciatic nerve, okay, so it's the back part of the leg that would be into pain. It would be leg pain or pins and needles, numbness, that type of thing, okay, because we're putting pressure onto the nerve root. If she had a higher level disc problem, so at L4, we tend to find as we do a leg raise on this side, it may reproduce pain on this side, okay? The lower level disc or nerve problems will be on the same side. Higher level can cause it on the opposite side.
Because I can feel it when they do this side, because they think that it was because of my broken tail.
Right.
It's that whole coccyx that it kind of, when you lift it here, I can feel, it doesn't hurt, but there is a noticeable something's going on, but yet this is the side that usually I feel nothing.
Interesting. So I'm surprised that your sacroiliac movement tests are as good as they are, seeing as you've fractured the tailbone, because often when you fracture the tailbone, you get some shifting of the sacrum, and that can create stiffness on one side or the other. But from what I see anyway, just on that testing, it looks pretty good. So
yeah. Well, I don't know, like you can, it wags out like it's
does it? Yeah.
that
Okay.
way, and I don't
Yeah.
know if that's